Warts appear suddenly and often grow in areas that are easily injured. Almost everyone faces this problem at some point in their life. Why does it happen? And how can we get rid of papillomas? In this video, we have collected the simplest, most effective, and importantly, affordable means of eliminating papillomas. Why do papillomas appear? The appearance of warts on the surface of healthy skin is not a normal process. They are a result of the activation of the human papilloma virus. About 90% of the world's population are carriers of this virus. However, why it remains dormant in some people and becomes a problem in others? Factors that trigger the human papilloma virus include weakened immunity, genetic predisposition, hormonal imbalances, close contact with carriers of the acute form of the virus, as well as constant skin traumas and failure to observe hygiene rules. How dangerous is the human papilloma virus? The human papilloma virus has more than 100 strains. Most of them only give rise to benign formations. However, some strains can cause the development of oncology. It is particularly dangerous to injure such warts, as the risk of tumor development and growth increases. Papillomas can appear on any part of the body, but they most commonly occur on the neck, chest, underarms, and genitals. Genital papillomas are particularly susceptible to injury, and given the influence of the microflora in that area, the risk of inflammatory processes is particularly high. In particular, the human papilloma virus is one of the key causes of cervical cancer. When should you see a doctor? In most cases, if a wart is not causing any discomfort, it is not a medical problem. However, pay attention to the following symptoms: pain, bleeding, pus, changes in color, size, or quantity of warts, as well as constant traumas. In such cases, you should immediately visit a doctor. Problematic warts are usually removed by excision, laser treatment, or electrical current. However, even painless papillomas can be bothersome, and people want to get rid of them. Is it possible to do so without surgical intervention? In folk medicine, there is such a method. And now we will tell you about an effective recipe for such a remedy. Papillomas, warts, and other formations on the skin fear this remedy. There are 3 main ways to apply lemon locally for warts. The first is rubbing the formations with lemon juice. Squeeze the juice from 1 lemon, moisten a cotton swab in it, and thoroughly apply the lemon juice to the papilloma. Repeat this procedure up to 5 times a day. The course of treatment continues until the wart disappears. The second method involves preparing a lemon ointment. Grind 1 lemon, including the zest, using a meat grinder. Add Vaseline and mix until homogeneous. The amount of Vaseline is determined during preparation. It is essential to achieve a consistency that is thick enough to adhere to the surface of the papilloma. Apply the ointment to them and wait until it is absorbed. Then add a new portion of the ointment. This continuous treatment gradually destroys the structure of the papilloma. The third method is using a lemon compress. Simply cut a slice of lemon, apply it to the wart, and fix it with a Band-Aid. The first time, do such a compress for 20 to 30 minutes. This is necessary to make sure there is no allergy to lemon juice. If no negative reactions occur, you can leave such a compress overnight. This accelerates the removal of warts. Another remedy for local application is lemon oil. Pass a lemon through a meat grinder. Pour olive oil over the resulting mass and let it infuse for 2 weeks in a dark place. Papillomas are treated with this oil twice a day. When using any of these remedies on dry warts, they should be pre-steamed. To do this, make foot baths for warts for half an hour. In 2 liters of hot but not scalding water, add a cup of chamomile infusion, a tablespoon of laundry soap crumbs, 2 teaspoons of baking soda, 100 milliliters of lemon juice, the same amount of camphor alcohol, and 3 drops of lemon essential oil. After steaming, remove the dead skin with a pumice stone, but be careful not to scratch the live skin and create a focus of inflammation. In addition to local application of lemon, you should regularly consume it, including the zest. However, first, the zest must be thoroughly washed with baking soda. Additional folk methods for removing papillomas. There are several very simple folk methods for removing papillomas. The first one is to treat the growth with hydrogen peroxide 4 to 6 times a day. It will take 14 to 16 days to remove the wart. The second method is to squeeze out onion juice and apply it to the wart with a cotton swab for half an hour. Repeat the procedure twice a day until the papilloma disappears completely. For the third method, you'll need garlic. Peel and finely chop it. Apply the resulting paste to the papilloma overnight for 1 week. Method number 4 is to rub the warts with potato juice. You need to squeeze it from peeled raw potatoes. And finally, the last method is to apply egg white directly to the papillomas. The treatment course lasts for 6 to 8 days. Keep in mind that some people may be allergic to these natural products. They should also be used with caution on delicate children's skin. Removal of papillomas and warts using dimexide solution. Before using dimexide, it is essential to ensure that you are not allergic to this medication. To do this, you can perform a sensitivity test. Apply a small amount of dimexide to the skin on the inner part of your wrist and observe the skin's reaction for 30 minutes. If there are no redness, itching, or other signs of an allergic reaction during this time, you can use dimexide to remove papillomas. The application of dimexide is very straightforward. Follow these steps. Clean the skin around the papilloma with soap or alcohol. Mix dimexide with water in a ratio of 1:3, 1 part dimexide and 3 parts water. Apply the mixture to the papilloma using a cotton swab or brush. Cover the papilloma with a plaster to avoid accidental damage. Leave the solution on the skin for 30 to 60 minutes. Rinse off the solution with warm water. Repeat the procedure once or twice a day for 7 to 14 days. Usually, after this period, the papilloma falls off on its own. But if it doesn't, you can repeat the procedure after a few days. It is not recommended to use dimexide on mucous membranes or on skin with wounds, scratches, or other injuries. Dilution nuances of dimexide. Dimexide is a sufficiently concentrated medication, so before using it to remove a papilloma, it needs to be diluted with water. The nuances of diluting dimexide with water lie in the correct ratio of components and adhering to safety measures. The ratio of components when diluting dimexide with water depends on the purpose of its use. For removing papillomas, a recommended ratio is 1:3, which means 1 part of dimexide should be mixed with 3 parts of water. If you are using dimexide for other purposes, the ratio may differ and depends on the doctor's recommendations or the medication's instructions. When diluting dimexide with water, safety measures should be observed as the medication can cause skin and mucous membrane irritation. Dilution should be performed in a well-ventilated area, and gloves and a protective mask are necessary. When mixing the components, water should be added to dimexide, not vice versa, to avoid splashing and getting the medication into the eyes. After dilution with water, the procedure to remove the papilloma should be started promptly to prevent the loss of medication concentration and rapid evaporation. Contraindications to using dimexide, besides allergy to the medication, include cardiovascular diseases, kidney, liver, acute phase of infectious diseases, open wounds, skin conditions, pregnancy, and children under 12 years old. When using dimexide for treating papillomas on the skin, absorption of the medication into the systemic bloodstream is usually minimal, and its concentration in the blood remains low. However, when using large doses or applying the medication on extensive skin areas, absorption into the bloodstream may be more significant. Removal of papillomas and warts using garlic. Warts are a phenomenon that can harm your skin and cause unpleasant sensations. But don't despair. Garlic is precisely what you need to combat warts and papillomas, and traditional medicine has long proven its effectiveness. The simplest way to apply garlic for papillomas is to take a few garlic cloves, cut them in half, apply them to the wart, and secure them with a bandage or plaster. Leave such a compress overnight, and in the morning, you will see how the wart begins to dry out and die off. Why does this happen? Garlic contains powerful antibacterial and anti-inflammatory properties that can help destroy the viruses and bacteria that cause warts. Additionally, garlic contains allicin, a substance that promotes the healing of wounds and various skin injuries. However, this is not the only method. There are more gentle options for applying garlic for papillomas. Take a head of garlic, peel it, and finely crush it to a paste-like consistency. Then mix the garlic mass with baby cream in equal proportions. Apply the resulting ointment to the warts in a thick layer and cover with plastic wrap for 2 hours. Perform this procedure in the morning after waking up and in the evening before going to bed. The treatment course lasts for 1 week, followed by a 3-day break, and then another week-long treatment course. During the application of the ointment, you may experience a slight tingling sensation, but if it is too strong, refrain from using this remedy. Another recipe is based on a combination of garlic and honey. Thanks to the addition of honey, this mixture is easier to tolerate and does not irritate the skin. Crush the garlic and mix it with honey in equal proportions. Apply the mixture to the papilloma and cover it with gauze for 15 minutes. Then rinse off the ointment with water. Repeat the procedure twice a day. The treatment course lasts for 20 days. Getting rid of papillomas and warts with garlic and povidone iodine. To prepare this remedy, you will need garlic and povidone iodine. Garlic contains the phytonutrient allicin, which suppresses viruses and prevents their penetration into the body. Povidone iodine is less toxic compared to other forms of iodine. It dissolves and absorbs well. Povidone iodine is used to treat burns and vaginal infections. The uniqueness of iodine compared to other antibiotics is that microbes do not develop resistance to it. Crush a small amount of garlic on a plate. In another plate or cup, add a few drops of povidone iodine. Take a tip of a teaspoon of garlic juice with garlic particles. Mix it with iodine and apply this mixture to the wart. Cover it with a plaster that has a protective cushion so that the adhesive part of the plaster does not touch the papilloma. Change the compress twice a day. In some cases, the wart may disappear in 1 day. However, sometimes you may need a treatment course lasting up to 6 weeks. This depends on the overall level of immunity and the specific nature of the papilloma. Additionally, it is worth boosting the immune system by consuming garlic in food and taking zinc supplements. Removal of papillomas and warts using the Kalanchoe home plant. Recipe #1. Take a freshly cut Kalanchoe leaf and place it in the refrigerator for 1 week. After the week is over, take out the leaf and finely chop it using a knife or blender. Then, wrap the paste in clean gauze, using 2 to 3 layers. Apply the compress to the surface of papillomas or skin lesions such as ulcers, boils, burns, and bed sores. Change the compress every 4 to 5 hours and secure it with a bandage for convenience. Recipe #2. Squeeze the juice from the aged kalanchoe leaves, which have been stored in the refrigerator for a week. Apply the juice to the affected skin areas 2 to 3 times a day, gently spreading it over the surface until fully absorbed. Repeat the procedure daily until you notice an improvement in the condition. Recipe #3. Take 5 kalanchoe leaves and finely chop them with a knife. Place them in a 0.5-liter glass bottle and pour medical alcohol over them. If not available, regular vodka will do. Store the solution in a dark place for 10 days, shaking it daily. After 10 days, strain the mixture inside the bottle and pour the contents through 2 layers of gauze into another container. Then store it in the refrigerator. Gently rub this tincture directly into the papillomas and other skin formations twice a day, in the morning and evening, and leave it to dry. Repeat daily until the unpleasant skin growths disappear. The juice and leaves of kalanchoe are particularly attractive because the only contraindication is an intolerance to the components of the plant. Pregnant and lactating women are recommended to consult a doctor before using these remedies. Contraindications to all methods of papilloma removal. For local treatment, products based on lemon should not be used in the presence of psoriasis, eczema, and other serious skin conditions. Patients with such conditions should consult a doctor before using ointments and compresses with lemon juice. It is also essential to ensure that there is no allergy to lemon juice. To do this, apply a small amount of juice to the forearm and wait for 15 minutes. If there are no redness or itching on the skin, then products with lemon can be safely used. Lemon should not be consumed internally by individuals with high stomach acidity and associated conditions, including gastritis and ulcers. Additionally, the juice of this fruit can erode sensitive tooth enamel. If you have any skin problems, it is best to consult a qualified medical specialist who can conduct a diagnosis and prescribe the appropriate treatment.